Epidemiology has been thrust into the spotlight in recent months, helping us track the viral threat. But companion animal epidemiology, which studies disease in pet populations, is a much younger field. Reporter Geoff March, who's fast becoming our dedicated dog correspondent, has been looking into the scientific literature because he's facing a difficult decision. Should he neuter his puppy Kevin? It's a common enough procedure in the UK, but what are the consequences? Kevin's testicles hang in the balance whilst Geoff investigates the evidence.
Kevin is my 6-month-old golden retriever, and avid Inside Science fans might remember him from a couple of months ago in my report about dog susceptibility to COVID-19. The risk was and still is low. But now he faces an altogether more imminent danger. The thought of deciding myself to put Kevin, arguably my best friend, under the knife makes me cross my legs firmly, but also want to make sure that whatever decision I do make is in his best interests. And I'll admit, manically scouring the internet in cross-legged determination to find pro-testicle literature doesn't score any objective analysis points, but it did land me on a Zoom call with a lovely married pair of veterinary researchers from UC Davis, California.
Years ago, many decades ago, it wasn't such a universal practice to neuter all dogs.
This is Professor Lynette Hart, and sat beside her Emeritus Professor Ben Hart.
Starting maybe 25 years ago, it started to become viewed as an essential thing to do. Veterinary students would almost hiss at me if I would tell them my dog is not neutered. And it's only been the last 3 or 4 years that people have started seriously questioning that practice.
The veterinary profession has not accounted for the most commonly performed operation in the practice, which is spay or neuter. The profession hasn't caught up with what's known about the physiology right now. It's almost just become part of the culture.
Over the past decade, Lynette and Ben Hart have been trying to get a clearer idea of whether neutering and the time you neuter affects certain joint disorders and some cancers across different breeds. They've collected data on thousands of dogs coming through the Veterinary Medical Teaching Hospital at UC Davis.
We've got data on 35 breeds of dogs, and we got some information on mixed breed dogs of different weight categories. So that's where we are.
The selfish question that's specific to my dog, Kevin, is what would your advice be for someone with a male 6-month-old golden retriever?
The male golden retriever, they do get the cancers. We found 3 cancers. As a matter of fact, left intact, not neutered at all, they're about 11% risk. Neutering them does not increase it. That's male golden. The female golden, left intact, has about a 3% chance of those cancers. But then you spay her, anytime up to 8 years of age, you increase by about 3 times the cancers up to kind of the male rate, up to about 12% or so. For joint disorders in the male, if you neuter your male at 6 months of age, you increase the chance of 1 or more of these joint disorders by about 4 times. If you wait for a year of age, you're back down to about 4% chance of a joint disorder. And that's about as low as it goes. So there's no reason to subject your dog to an increased risk of a joint disorder because joint disorders are so painful and they're so hard to take care of. We think it's the decision of the pet owner, not the society's expectations, that should dictate what's done.
Thank you. That's helped me with regards to Kevin. What would be your advice to dog owners in general? Because I assume it's not going to be a one-size-fits-all solution for dogs, given how different they can be in shape and size and presumably physiology.
You're absolutely right. We got Chihuahuas on one hand, we got Great Danes on the other hand, and as it turns out, the age of neuter or spay on a Chihuahua makes no difference with regard to the joint disorders that they be predisposed to or the cancers. You can just spay a neuter Chihuahua anytime you want. That's what our data show. Whereas in a German Shepherd, time of spay or neuter makes a big difference because if you do it at 6 months, which was the mantra for a while, you increase the chance of a joint disorder by about 3 times. If you wait until they're a year or 2 of age, you're down to about a 5% chance of a joint disorder. If you want to avoid increasing the risk, that's where you have to pay attention to the age of spay and neuter.
According to what Ben and Lynette's data show, it's unlikely that neutering Kevin now would increase his cancer risk. But if I did decide to go ahead, delaying for 6 months until he's about a year old, that could reduce the risk of him developing certain joint disorders. But is it right to base my decision on a couple of published papers looking at specific disease risks from across the Atlantic? I contacted Dan O'Neill for a second opinion. He's a companion animal epidemiologist at London's Royal Veterinary College and runs Vet Compass, which collects data from vet practices across the UK. Dan told me that when it comes to dogs, 44% of males and 45% of females are neutered here, and he's also started asking questions about some of the potential impacts this practice could be having on certain breeds. With my dog Kevin firmly in mind, I sent him Ben and Lynette's paper looking at golden retrievers.
That paper is one of the unusual ones almost that did a priori in advance set out to explore neuter. But we have to be really careful when we interpret the results from a study like that.
Why?
The animals that were included in that study were referral animals in a university teaching centre. In the process of that filtering, we introduce huge bias. So the possibility of living longer, of getting referred, of being neutered, a lot of those are driven by owner preference rather than by the intrinsic risk factor that we're trying to explore, which is neuter directly affecting the risk of disease. We have this huge complication of human decision making in the background.
Dan and I talked for a while about the different sources of bias that can creep into these sorts of studies. Ideally, we'd have what are called prospective cohort studies, where a group of dogs are followed from birth, as opposed to a retrospective cohort study which looks back in time, like Ben and Lynette's paper on the Goldens, and that is now starting to happen in the UK. But statistical power arguments aside, Dan seemed to think that basing my decision on some potential risk of certain disease years in the future was blinkered, to put it mildly.
When it comes to you deciding to neuter Kevin, you have to think about it from Kevin's perspective. There is a possibility he might die under anaesthetic, in which case, whether or not he would have got cancer in 10 years' time is an irrelevance. It was the wrong decision in that specific instance to neuter him. The second thing you have to answer is, why are you doing it? Is Kevin currently presenting with behavioral problems, perhaps, so mounting your legs, mounting other dogs?
No, he's not.
So then you have to ask yourself, why are you getting him neutered? And often the reason is because everybody else is getting them neutered. But if we were to take you on a little trip, when we went to Sweden, virtually none of the dogs there are neutered. It is not a cultural norm and it's not a legal norm. You then have to look at population effects. So a lot of neutering is promoted because it is good for dogs at a population level. Now, is that Kevin's problem? No. Is it your problem directly in the case of you and Kevin? No. But it may well be that there is a benefit for dogdom within the UK. We then have the ethical issue. Have you got the right to neuter Kevin? It is not for therapeutic purposes. You've just told me there's nothing wrong with him, but you are going to put him under anaesthetic, which has a risk, have a surgery done, which has some pain, and remove some normal parts of his body and a normal long-term hormonal effect on him. And interestingly, when I had my own small animal practice in Kent, we had just 2 vets there. And quite routinely, if clients came to me, they would get one answer about castration. And if they went to the vet in the very next room, less than 5 yards away from me, they would get a different answer. This is why this decision is just so complex. And once the deed is done, you can't go back. I do not envy you this decision, by the way. I suspect if we asked Kevin, I think I would know what Kevin's answer would be.
Kevin's balls remain firmly in place for now. There are, of course, loads of legitimate reasons to neuter your dog, and waiting longer does make it a bigger, more expensive surgery, and can lower the chances of changing the unwanted behaviours that have had more time to become ingrained. But as these sorts of studies continue to work their way into journals, we'll all hopefully have more data at our fingertips to help us decide. The big question for me is, will that make the decision easier or harder?
Geoff March and Kevin, the latter blissfully unaware that his balls are being debated on Radio 4, or even how close he came to losing them. And please don't write in about neutering cats. They are a completely different kettle of fish.